Calling the 1 o'clock calendar for the Committee on Health and Human Services. First up, we have SB 3132 relating to syndromic surveillance. First up, we have Department of Health in support. Are you present? Come on up.
Hi,
Hello.
Good afternoon, Chair, Vice Chair, and Committee.
Yes.
My name is Nathan Tan. I'm the Deputy State Epidemiologist and here to offer testimony with written testimony as well in support of the bill.
Okay. So we have read your written testimony. If you'd like to add or just rest on it, we're happy with that. There's no, yeah, go ahead.
Yeah, just some very brief comments. It's really just to formalize the ability to establish a syndromic surveillance program. Currently, there is one at the federal level that relies on voluntary participation, and it's provided some really important data for the health department in terms of response. I think most recently it's been able to provide some real-time data related to the flu activity in the community. It's also provided information in response to the Maui fires. We think it's important. It will ensure the department can continue to collect and analyze syndromic surveillance data even if the federal platform ceases to exist and no longer able to meet the department's needs.
Okay, thank you very much.
Thank you.
Next, we have SHIFTA in support. Dr. Lewin.
Madam Chair, Vice Chair, we will stand on our written testimony for this bill in support. Great.
Okay, thank you very much. Next up, we have Paige Choi, Healthcare Association of Hawaii in support. Paige.
We'll stand on our support. Thank you.
Thank you very much. Next, Hawaii Pacific Health, Michael Robinson in support.
And a strong support.
Thank you. Next, we have Devon Janua in support. Corinne Solomon providing comments. Maya Maxim in support. Deborah Umiamaka in opposition. Patricia De Los Santos in opposition. Kirk Powell's in opposition. Anybody else wishing to testify on SB 3132? Members, any questions? Okay, I think for Department of Health, I have a question. Come on up.
Way in the back of the room. You should start using drones, and the drone will fly over to you.
Okay, so the people who are in opposition are super concerned that a centralized health data collection under 3132 is going to, have privacy risk, and what's your position regarding that?
Privacy is extremely important for the department, and the information that we receive is de-identified, so we're not able to identify who, identify the people that are related, to
the data you get, right? But there's not going to be any social security numbers. There's not going to be any date of birth. Okay, so that should satisfy the privacy issues. Okay, thank you. Anybody else wishing to testify in 3132? Members, no more questions. Moving on. SB 3134, relating to emergency medical systems of care. First up, Dr. Lewin, State Health Planning and Development Agency in support.
In support. Madam Chair, Vice Chair, I'm also sitting on MSAC. I just want to but this is really going to modernize our whole EMS system. It's a very, very responsible and good bill. We strongly support it. Thank you. Right.
Thank you very much. Department of Health in support.
Stand on our written testimony, Madam Chair.
Okay, I know who you are, but please identify yourself.
Garrett Hall, State Chief of Emergency Medical Services and Injury Prevention for the State of Hawaii Department of Health.
Thank you very much. Next, Major Stephen Logan, Department of Defense.
Brigadier General retired Nilman Shio, standing in for General Logan. The department stands on its written testimony support.
Thank you very much. Okay, Department of Health, EMS Medical Director Terrence Jones, MD, in support. Ronald Kuroda, EMS Injury Prevention Systems, Medical Director of Oahu Department of Health, in support. Eric Vaughn, EMS for Kauai, Medical Director for Kauai, in support. Karen Boyer, University of Hawaii, in support. Karen, are you present?
Here, we stand on our testimony. We were in support with considerations.
Okay, thank you very much. Thin Wen, Dr. Wen, in support. Cecilia Wang, in support. Marilyn Matsunaga in support, James Barros of EMS in support, Emergency HIEMA, Emergency Management Agency in support. Anybody else wishing to testify on SB 3134? Members, any questions? Okay, no, moving on. Next one. SB 3136, relating to lead materials and water infrastructure. Department of Health in support. Please proceed, identify yourself.
Good afternoon, Chair, Vice Chair, committee members. My name is Joan Corrigan. I'm with the Department of Health Safe Drinking Water Branch, and we stand by your testimony.
In support, okay. Thank you. Dr. Lewin of SHPTA in support.
Yes, we'll stand on our written testimony, Chair.
Okay, next we have Gabriel Agonat in support. Anybody else wishing to testify on SB 3136? Members, any questions?
Super fast of SHPTA, super fast, super
Yeah.
fast. I'm like literally, if the federal government were to weaken the standards under the Clean Water, Safe Water Drinking Act, would we have to follow suit under this bill?
I believe we would act as Western States Alliance and change the standards to meet our own desired
Okay,
standards.
so if we pass this, you'll still have the flexibility to do that?
We'll still have the flexibility to do that. We're doing that for vaccines. We'll do it for other kind of protections.
And we have the health, clean water person right behind him.
Absolutely.
Is he right?
I'm with Joan Corrigan of the
Yeah.
Safe Drinking Water Branch.
So
You
did
just
you
go
hear the
thumbs up or thumbs
question?
down, like yes or no, what he just said.
I'm sorry, I didn't hear, please.
Oh, if the feds weaken the standards, would we have to follow suit under this bill if it became law?
No, we would not have to, as long as we are as stringent or more, we would still be fine. And I don't think that we would end up having to change it. The whole intent is to be protective.
Yep, exactly. I just want to make sure, because if we follow federal standard weakened, we don't want to be pushed into a weaker standard.
Okay, and we are part of the Western Alliance,
Perfect.
so we'll see.
Okay,
Okay, thank you very much.
That's the only question I have.
Okay, moving on, SB 3138, relating to independent audits of deposit beverage distribution. First up, Department of Health in support, Lauren Zerbel in support. Lauren, for Hawaii Food Industry Association, are you present? I see you, move on. Please proceed.
Thank you. We're here to testify in support with amendments. We prefer the language that does a full exemption for internal audit. The Department of Health has ample funds in their High Five Special Fund, about $80 million with which to pay for audits. They have the authority to do that. The language about auditing in the current statute is very confusing. Auditors don't really know how to do it. Our members have been quoted $25K per location. It's a lot of money. It's actually more money than most of them give the state in High Five tax dollars, so it really doesn't seem to make much sense to us. So we would support with amendment. Thank you very much.
Thank you very much. John Mark Maggio of ABC Stores and support. Garrett Marrero, Maui Brewing Company, providing comments. Garrett, please proceed.
Thank you. Good morning. I'll be quick. Thanks for the opportunity to testify. We would be in support with amendments. As it currently stands, we would raise the threshold for the smallest producers from 2 to 5 million containers. And then we would ask for a modernized reporting system rather than paper, stamp, and mail each month. It should align with the M18, GET, and other common forms that we all file for business. As you know, as part of the info brief earlier this year, late last year, and I'm happy to continue to work in service of the state to support this. And it's mainly, my concerns are all around how it impacts the small businesses. As Lauren mentioned, very expensive, very confusing auditing requirements. So with the edits and comments that I provided in my testimony, I'll stand there. Thank you.
Okay, thank you very much, and thank you for participating on that info briefing. So
Always, ma'am.
Thank you. Down to Earth, Organic and Natural in support. Allison Riggs, Tom Yamachika, Tax Foundation of Hawaii, providing comments. Tom, you don't look like Tom. Tom, are you present on Zoom?
Not present on Zoom, Chair.
Okay. Steve Hobstyle of Lanikai Brewing Company, providing comments. That looks like you. Steve?
It does. Hi, Chair, Vice Chair. Thanks for the opportunity. I'll also be brief. I mirror Mr. Marrero's testimony where, as a small brewer myself, it's very impactful on the cost. So getting the units up to 5 million and digital filing would make much more sense from the small business perspective. Here for any questions you might have. Thank you very much.
Thank you very much. Kenneth Hu, Hawaii Liquor Wholesalers Association in opposition. Rob Iverson, Reynolds Recycling in opposition. Reynolds Recycling.
Bruce Iverson,
Bruce Iverson, sorry.
for Reynolds Recycling. I'll stand on my testimony in opposition.
Okay, thank you very much. For SB 3138, anybody else wishing to testify? Members? Yes.
Department of Health, if I would like to provide a little bit of clarification, if possible, on our testimony.
Okay, identify yourself.
Lene Ichinotsubo with the Department of Health, Solid and Hazardous Waste Branch. The department strongly supports this measure. We believe that this provides a balance between the auditor's comments and alleviating the financial burden on small businesses. Using FY25 data, the proposed measure will only affect 24 distributors out of 322. 5 will be required to submit independent audits every 2 years, and with 19 distributors every 5 years. Thank you for the opportunity.
Okay, thank you very much. Anybody else wishing to testify on SB 3138?
Excuse me, Chair?
Yes, Tom
Yamachika
Yamachika,
now.
please proceed.
Thank you, Chair, members of the committee. Tom Yamachika from Tax Foundation. We will stand our written testimony, be available for questions.
Okay, thank you very much. With late testimony we have for Medical Dairies in support. Anybody else wishing to testify on SB 3138? Members, any questions? So I have one for Department of Health. So you've heard from Garrett Morero of Maui Brewing and Lanikai Spirits. What do you folks think about being able to modernize the submission of these audits by putting it in web-based, like how Department of Taxation is doing now for GET tax?
So we are currently working on an electronic system for distributors to submit information to us, and we've just released that contract, and that's being done. We haven't thought about that for the audits itself, but we can certainly consider that in that scope.
Okay. When you mean that you folks are working on it, when will it get done regarding the information?
So the work that's being done now is for the submissions for each, the monthly payments into the system. So that is being worked on now. We anticipate having it done, was it the end of this fiscal year? We're working towards pushing it this summer.
Okay, so we're looking at 2026.
Yes.
Mid-2026. And that's only for the submission of the payments, which
Correct.
is similar to tax, except the actual form of the audit, you don't have that capacity yet, because you haven't sent that out for an RFP or anything.
No.
Okay, sounds good. Any other questions?
Why not?
Okay, why not?
I mean, it's everybody else is moving at the speed of technology, but yet you guys are thinking about it, and you have a lot of money in this fund. Why not? Why not? Why haven't you just gone for this already?
For the audits?
Yeah.
That's something we need to consider. We haven't. We're in the process of also doing an RFP to hire an auditor to do the risk-based audits, but that's something we do need to consider. I agree.
Well, I'd hope you would move quicker on these things, but okay, thank you, Chair.
Okay, thank you very much. Any other questions? Okay, seeing none, moving on. Next, we have SB 3139 relating to State Health Planning and Development Agency. First up, we have, Grassroots Institute of Hawaii and support. Okay, next we have Walden Au providing comments. For HMSA.
Chair, Vice Chair, members of the committee, Walden on behalf of HMSA. We're just here to provide comments that specifically Provision 2 found on page 3 currently should be under the purview of the Insurance Commissioner and DCCA. Otherwise, support the intent of the measure. Thank you.
Okay. Okay, Dr. Lewin from SHPTA in support.
Chair, Vice Chair, Senator Favela. I'd love to comment on this. SHIP is a 50-year-old agency this year. And when it was originally created, it had a very broad spectrum of responsibility. It was mostly federally funded back in those days. The federal funding went away, and we have our regulatory function of certificate of need, but the bigger picture wasn't funded or staffed to really occur. So today, we're moving toward really being a kind of, not a health authority with regulatory pressures all over the health sector or other agencies. But I think it's important to say the function of SHPTA is redefined as universal access to high quality, equitable, and affordable health care for all the people of the state, and to create a shared vision of Hawaii's healthcare future. That means like sort of dealing with the silos that we create across all the agencies that have something to do with health, but also bringing our very excellent private sector into this mix and trying to envision together with this physician governor, where are we going? So that's basically what this is.
Thank you, Dr.
There are some housekeeping CON things, DON exempted, and we think we support those as well.
Thank you, Dr. Lewin. Okay, anybody else wishing to testify on SB 3139? Members, any questions? Okay, I have one for Dr. Lewin. You heard HMSA. They think the health insurance coverage rates, benefits, affordability, etc., should remain with insurance commissioner and not under.
Yeah, we're not going to be regulating those, so that's fine.
So you're okay with
this bill is
omitting.
really about persuasion and collaboration. There's no regulatory power beyond any of those factors.
Okay, sounds good. So you have no problem with removing that portion?
No problem at all.
Thank you. Okay, any other questions? Okay, seeing none, moving on. Next up, SB 3207, relating to background checks. First up, we have AG in opposition.
Good afternoon, Chair and Vice Chair. Angela Takuda, Deputy Attorney General. Please stand by written testimony in opposition to the bill.
Thank you. Healthcare Association of Hawaii and support, Paige Choi.
Thank you, Chair, Vice Chair, members of the committee. Paige Choi with the Healthcare Association of Hawaii. We do stand in strong support of this measure. Our testimony, I think, really details the issues our members have encountered in the past few years since the fingerprinting requirement has started to be enforced by the Department of Health. There are major issues that we're experiencing with cost, accessibility of appointments, and the compliance with other Hawaii state laws, in particular, employment non-discrimination laws. We do think a bill is needed. We really hope that you folks will pass this measure today. We understand the concerns raised by the AG and the Department of Health. We think we can work through those as we go through this process, but we do think that this bill is needed to address a lot of the burdens that our members have been experiencing. So thank you, and we're available for questions.
Thank you very much. Next, Hawaii Pacific Health and Support, Michael Robinson.
Good afternoon, Chair and Vice Chair. Mike Robinson, Hawaii Pacific Health. You have my written testimony. I just want to emphasize that this is not about us being opposed to background checks. This is us having concerns about the incremental value of fingerprinting, FBI fingerprinting specifically. All of our facilities have done background checks well before this bill was made into statute in 2006. It hasn't been enforced for that long, and we haven't had any issues. We perform background checks on all of our 7,700 employees. Half of our employees are licensed professionals. Some of those licensed professionals are already getting fingerprinted through the licensing procedure. This would be an additional requirement, and it's also sole sourced to a vendor where we have to pay $70 per employee, and that is an unfunded mandate. It's a cost that we will have to bear. This is also unfortunate when it's coming at a time when we are trying to attract people into the industry, and this bill does not allow for it to be in compliance with Hawaii labor law, employment law. Thank you.
Next, we have Jonathan Ching, Kaiser Permanente, in support.
Chair will stand on our testimony in support and request the amendments of the Healthcare Association.
Okay, thank you very much. Next, we have Edward Chu, Hawaii Health Systems Corporation, in support. Darlene Nakayama, Palolo Chinese Home, in support. Rehabilitation Hospital the Pacific, in support. Queens Health Systems, in support. Maya Maxim, providing comments. Dr. Fink, the Director, Department of Health, in opposition. Department of Health, come on in.
My name is Paula Serio. I'm the Chief for the Office of Healthcare Assurance. We stand on our testimony in opposition of this. The way that the bill is currently written, it is an issue that it is saying that the entity, like the hospital or the third-party provider or the operator, would do their own background checks. That is against federal law. So we have that in our testimony, as does the AG, and the department would prefer to work with stakeholders and with HHS to avoid any kind of statutory change and address the concerns that stakeholders have.
Okay, thank you very much.
You're welcome.
Next we have Brenda Ho, Hawaii Care Choices, in support. Dr. Ignacio, Hawaii Medical Association, providing comments. And Hannah Litt, in support. Anybody else wishing to testify on SB 3207? Members, any questions?
Quick question. Okay, Chair?
Yeah, please proceed.
Hospital guys. No, I saw.
Robinson, and we also have Jonathan Chin.
No, I don't want all you guys up here.
Well, you said hospital guys.
We're good. No, really.
Only one we're missing
Your Department of
here
Health
is-
said what she said. You guys were shaking your head, so I want you to respond because I want to know more about the shaking of the head.
Sure. You want to go first, or?
Well, I think one of the concerns that we have is there's no federal requirement right now for fingerprinting of healthcare employees. We understand there might be some concerns around the vendors and who can use the vendors. A major problem we're having right now is there is only one vendor, and they are charging a huge amount. For one of our nursing homes, we can say it cost almost $200,000. Again, totally unfunded. And then for our larger systems, closer to $500,000, and that's the one time, right, to get everyone in compliance, and then you'd have to continue that cost going forward. So again, as my colleague said, we're not opposed at all to patient safety and doing these background checks, but we are concerned that we're implementing something above and beyond what's required federally, and at such a high cost with such limited choice.
Yeah. And I'll just add, Vice Chair, to that. I was shaking my head because I'm not aware of what federal law is that we were not in compliant with not doing FBI fingerprint checks. We're not talking about background checks. So if there is a federal law out there, we have not been in compliance on it since the beginning, and it has never been brought up.
That's what I figured. And then just to be the honest conversation, with this continues, these costs, they get passed on to the patients eventually, right? So this is a drive. We talk about trying to contain healthcare costs. These are kind of some pragmatic things that we could look at, correct?
I'll just add further thing about the federal law. Right, so for Kaiser, there's no other state that requires every employee that has, patient access to require them to have fingerprints. There are some select, right, and for purposes of licensing as a professional, but we're unaware that there's any state that would require what is currently, that the administration is currently requiring, and as comprehensively, right?
And there already is fingerprinting for many officials through their licensure, right?
For nursing, there is. Physicians are not currently fingerprinted, so this would be another burden that they would have to go through. And this would be for both current physicians as well as prospective physicians. So for any new physician we want to recruit to Hawaii, we would be the one of the probably a handful of states that are asking for this, that they would have to be fingerprinted by the FBI. It's just, unusual.
Thank you very much.
Thanks.
Thank you, Chair.
So I have a question. AG, come on up, and might as well Department of Health. Well, mostly AG, right? Well, whoever, or Department of Health, because you guys are in opposition. And the reality is, and I'm gonna tell the healthcare guys, and if we pass this and if the AG says this is wrong, you know, the governor is gonna veto it. So it doesn't make sense for us to pass something that the AG is uncomfortable with, right? So you heard their response. What is your response? Is there a federal law that requires the fingerprinting be done how Department of Health requires it?
Yes, I mean, I think
mentioned
their comment is a little bit different as far as fingerprinting requirement federally. All we're commenting on is the proposed changes that the hospitals want to do is not federally authorized. The hospitals themselves cannot collect fingerprinting, so that's the only thing that we're commenting on. So whether or not they're required to do it, that's a separate question.
Oh, it's a collection.
Yes.
Of
Yeah,
the
we're
fingerprinting.
commenting on the actual collection of the fingerprinting, which is solely under the authority of the FBI.
I see.
Yeah.
Okay, and that's in the bill.
Yes.
Okay, but you folks didn't propose any amendments. You folks just basically say hold this bill, which is to kill it. Okay. And Department of Health, it's basically the same thing. It's the whole holding of the collection of the
This doesn't
fingerprint.
just apply to hospitals. This bill applies to all licensed healthcare facilities in the state. So care homes, nursing homes, CCFFHs, everything, home health agencies. So to put this bill in the way it is, it would impact absolutely everybody. And a lot of those providers are already doing what is in statute, which is a fingerprint and
No,
all the
they're
background
doing
checks.
it, but they don't want to pay the expense because they're saying
I understand, yeah, and we recognize that it's an unfunded mandate and would be supportive of public funding for that. The other piece, I know, the other piece about that. The other piece about this, just to point out, is it is for long-term care facilities and critical access hospitals, it is required that they do a federal fingerprint. So, and they're covered under OCA's licensing as well.
Okay, thank you very much. Any other questions? Okay, moving on. SB 2271. First up, relating to hospital licensing. First up, SHPTA, Dr. Lewin, in support. Next, we have Daintree Bartoldas of Hawaii State Council on Developmental Disabilities.
Chair.
In support.
Vice Chair.
Wait, hold on. You're standing on your written testimony, right? Yeah, because you didn't stand up. Okay, next. Okay, Daintree.
Daintree Bartoldas, Executive Director for the Hawaii State Council on Developmental Disabilities. Yes, we are in support of SB 2271, allowing hospitals to demonstrate compliance through any CMS-recognized accreditation, helps sustain hospitals' capacity, particularly in rural and neighbor island communities, which is essential for assuring access to care for all of its residents, including folks with disabilities. Thank you so much for this opportunity to testify.
Okay, thank you very much. Healthcare Association of Hawaii, Paige Choi, in support.
Thank you, Chair, Vice Chair. We're in strong support of this measure, and we do also support the amendment suggested by OCA and the Department of Health for this particular measure, just to change the word to approve, CMS-approved accrediting organization. Thank you.
Okay, thank you very much. Next, we have Kaiser Permanente in support.
We'll stand in support.
Dr. Fink, Department of Health in support. Okay, anybody else wishing to testify on SB 2271? Members, any questions? Okay, moving on. Oh, we also have Senator Kilhokolole and Senator Favela present. Okay, next up, we have SB 2272, relating to home health licensing. First up, Hawaii State Council on Developmental Disabilities, Daintree. Oh, no, you're not Daintree. Okay, identify yourself.
Yes. Hi, Chair, Vice Chair, members of the committee. I'm Megan Han, interning for the Hawaii State Council on Developmental Disabilities, and we stand in support of SB 2272. The Hawaii State Council on Developmental Disabilities supports this measure because individuals with developmental disabilities frequently rely on home health services to remain in their homes and communities so that they can avoid unnecessary hospitalization and institutional placement. Thank you for your time.
Okay, thank you very much. Next up, we have SHPTA in support. Healthcare Association of Hawaii in support.
Well, Thank you. We'll stand on our testimony and support, again, supporting the OCA amendments. I do want to note this is important to maintain high quality of care and high quality standards, but this is a measure that we can do to help reduce costs overall for the system by not duplicating surveys. So thank you.
Thank you very much. Next, we have Department of Health and Support. Anybody else wishing to testify on SB 2272? Members, any questions? Okay, moving on. SB 967, relating to health. First up, we have Director Yamane, Human Services, providing comments. Okay, Meredith.
Aloha, Chair, Vice Chairs, members of the committee. We stand on our written
Identify
testimony.
yourself. You're not Yamane.
I'm sorry, I'm Meredith Nichols, Department of Human Services.
Okay, you stand on your written testimony. Thank you. Next, State of Hawaii Insurance Division, providing comments.
Acting Chair, Vice Chair, member of the committee, Justin Chu from the Insurance Division, DCC, stands on its written testimony providing comments.
Thank you. Dr. Luan Shipta, providing comments.
Stand on our written testimony.
Okay, thank you very much. HMSA, providing comments. Okay, Walden now. Okay. Next, we have Shelby Pikachu, billionaire of Ohana Unity Party and Kingdom of Hawaiian Islands in support. Shelby, are you present on Zoom?
No, present on Zoom, Chair.
Okay, Don Wakukava in support. Courtney Kasir in support. El Elento in support. El Elento, are you present on Zoom?
She is, but her mic is off.
They are present,
Please
Chair.
proceed. Could you unmute yourself and put your video on, please? Ms. Alento? Okay, while we're waiting for anybody else wishing to testify on SB 967 regarding ketamine. Okay, we're gonna move on, Ms. Alento. Next, we have SB 2285 relating to complex patient treatment. First up, we have the Department of Health, Hawaii State Department of Health, providing comments.
Good afternoon, Chair. John Valero with the Alcohol Drug Abuse Division, standing on our written testimony. And thank you.
Thank you very much. Alan Johnson, Hawaii Substance Abuse Coalition in support.
Chair, Vice Chair, distinguished members, I'm Alan Johnson, Hawaii Substance Abuse Coalition. The substance abuse agencies have evolved. We treat substance abuse and mental health, severely mentally health in one setting. We do not treat substance abuse and those with significant mental health, which is a huge population that often has physical illnesses as too. This is an unserved population. The federal government has decided to move forward. Grants are coming forward only to those states who have a pilot project. 7 states got it this year, be 20-some next year. If we have a pilot project, we could do it. Hina Mauka and Aloha House have already started this through grant and aids from you folks and community grants. We've already started this project. We have doctors and nurses. We're working really well with it. We're ready to do this pilot project. 54,000 people need this. They're expensive people. This is the gap that we're not getting in substance abuse. We could use your support. Thank you.
Thank you very much. Brian Baker, Hina Mauka in support. Brian? Okay.
Aloha, Chair San Buenaventura, Vice Chair, and members of the committee. My name is Brian Baker, President and CEO of Hina Mauka, a mental health and substance abuse program on Oahu and Kauai. I strongly support Senate Bill 2285 because the current system fails people with complex needs. Every day, we serve individuals living with substance abuse disorders, serious mental illness, and chronic medical conditions all at the same time, yet our system treats them one diagnosis at a time through separate and disconnected systems. When care is fragmented, people struggle with recovery and end up recycling back to emergency rooms, hospitals, homelessness, and incarceration. SB 2285 recognizes the simple truth: people do not live in silos, and neither should treatment. Integrated complex patient models reduce crises, improve stability, lower public costs, and position Hawaii for new federal funding. SB 2285 is a commitment to coordinated, effective care. We would appreciate your support. Mahalo.
Thank you very much. Oh, you're right on time. Okay, thank you. Thank you for that. Okay, next up we have Greg, I can't pronounce the last name, Tijapix of Coalition for Drug-Free Hawaii. I apologize for mispronouncing last name. in support. Dr. Nasha, Hawaii Medical Association, in support. Heather Lusk, Hawaii Health and Harm Reduction, in support. Anybody else wishing to testify on SB 2285? Seeing none. Members, any questions? Okay, seeing none. Moving on. SB.
Would it be possible to go back to 1997? El Ilento is now.
El Ilento, are you still here? Okay, good. We're gonna go back to, which one is it that she's testifying to? Ketamine.
Ms. Ilento, if you are driving, please pull over before you give your testimony.
Your sister's driving.
Okay, thank you.
I'm a
Just checking.
passenger. Yes, I apprate that. I'm
just 1
supporting
minute
this.
regarding,
No problem. My doctor, Dr. Robin Martin, has highly
okay, we lost you.
And you know there's one. Oh, you did?
Okay, we'll get back.
Okay.
Please proceed. We got you back again.
Okay, thank you. I'm in support of this bill because I believe people like myself would benefit from this particular drug therapy, and even just if there's one they're willing to pay for, that like private insurance, and it's not working, then we need to have the next one that is effective, and it's very expensive, so people like me can't get it, although I've been able to trial it, and it's been very effective for me. Thank you for the opportunity to present testimony, and please highly consider passing this bill. But as before, I know this bill's been out, at least 3 years for private insurance as well.
Thank you very much. Okay, moving on. SB 2289 relating to certificates of need. First up, SHPTA, in support.
Aloha, Chair, Vice Chair, and members. We support the intent of this bill to streamline some certificate of need program exemptions. We did want to mention, though, in our testimony that ambulatory healthcare facilities shouldn't be exempted. We'd have all kinds of, investor folks popping in here with surprise facilities, similar with the federally designated medically underserved areas. That's basically the whole state, in all the rural areas. Again, that would just be an overreach for poor quality investment coming in to compete with our existing healthcare system. We also would ask that we oppose the exemption for substance abuse treatment programs. A little bit more complicated there because we don't require CON for substance abuse treatment.
Sorry about that.
But unless they're residential and they're inpatients in the facilities, there's a lot of consternation in communities about placement of these kinds of facilities in neighborhoods, and we understand though that CON does have a required notice. But that particular, the wording in the bill doesn't really take into the CON program. So we oppose those, and the neonatal intensive care units, the others. So you've got our stuff.
Yeah, I got your written testimony. Thank you very much.
But we're not opposing everything.
Okay, I understand that. Grassroots Institute of Hawaii and supported Kafalas. Paige Choi, Healthcare Association of Hawaii, providing comments.
Thank you so much. I do want to echo a lot of what the SHPTA administrator said, and I just want to comment that we met with our hospice leadership committee meeting this morning. They're very concerned about some of the exemptions in the bill. I think they understand that, we don't have to have a CON for everything, but for hospice in particular, there is a lot of fraud that we're seeing on the mainland in the program. I think the CON has been a very effective tool here to keep a lot of those fraudulent or opportunistic actors out. And so we are concerned about the exemption for the hospice homes, but also, as noted, the federally designated medically underserved. That's a really large population, and that could be an opportunity for some bad actors to come in there. In some states, actually, Medicare is not allowing new hospices to open up, or they're under strict scrutiny. So we feel like we don't want to get to that point, and that's why we want to make sure we're protecting this particular framework here in Hawaii. So thank you.
Okay, thank you. Next, we have Michael Robinson, Hawaii Pacific Health, providing comments.
Good afternoon, Chair, Vice Chair. We have comments. We are concerned, particularly in the area of the exemption of specialty services here namely NICU services, pediatric service, and burn center. One of the reasons is one of the mandates of SHPTA, one of the cornerstones of our state is that we do have a SHPTA, and they do manage quality. And one of the things that they run under the Certificate of Need program is to ensure that a new entrant that provides a service has the basic minimum quality standards. And we're also concerned with private equity doing, entering into our marketplace. We have a non-profit system. So I think for, our feeling is that for SHPTA to not have oversight on the total management, we heard earlier that that is a desire of that department to do, exempting out specialized services, particularly in areas like burn center or NICU, where you really want to have kind of the best providing it and not somebody just off the street. The Certificate of Need provides safeguards against that. So we have concerns around that. Thank you.
Okay, next we have Navian Hawai'i and providing comments.
Richmond Lazar testifying on behalf of Navian Hawai'i. We'll stand on our written testimony with comments. Thanks.
Thank you very much. U.S. Renal Care providing comments. Melissa Pavlicek.
Stand on our comments.
Thank you very much. Knee Regulatory Research Center providing comments. Queens Health Systems providing comments. Maui Health System in opposition. Liberty Dialysis, Venus Kidney Care in opposition. Lila Moore in support. Corinne Solomon in support. Hawaii Care Choices in opposition. Anybody else wishing to testify on SB 2289? Okay, come on up. Identify yourself.
With apologies, we submitted some late testimony. My name is Melissa Pavlicek, and on behalf of Bristol Hospice, our testimony is in opposition, but it really is only pertaining to the exemption for hospice and pediatric. You've already heard other testifiers express a desire to keep the certificate of need for those two types of services, and just wanted to underscore our support for that.
Okay, anybody else wishing to testify on SB 2289? Members, any questions? Okay, moving on. Can we go on with decision making? Okay, so we're going to do decision making on this calendar and last week's calendar, okay? So first up, SB 3132. Chair's recommendation is to, as soon as I find it, and all of my crap here. 3132, pass with technical, non-substantive amendments for clarity and consistency. Any comments, questions, concerns? Seeing none, pass with amendments. Vice Chair for the vote.
Okay, thank you very much. Recommendation 3132 is a Senate Draft 1, noting the excused absence of Senator Kanuha. Of the members present, any WRs or no's? Seeing none, recommendation adopted.
Okay, next one, SB 3134. Chair's recommendation is to pass this with Department of Health's proposed amendments and technical non-substantive amendments for clarity and consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Okay, 3134, recommendation Senate Draft 1, noting the excuse of Senator Kanuha. Any WRs or no's of the remaining present members? Seeing none, recommendation is adopted.
For SB 3136, Chair's recommendation is to pass it as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation 3136 as is, noting the excuse of Senator Kanuha. Members present, any WRs or no's? Seeing none, recommendation adopted.
For SB 3138, Chair's recommendation is to pass with amendments. We're going to accept Maui Brewing and Lani Kai's proposed amendments. And so on page 2, lines 15 and 20, we're going to replace 2 million with 5 million and add a subsequent purpose for sub 4 to require Department of Health to develop a web-based systems to allow for internet submission by distributors of the reports required by this chapter.
Nice.
Okay, and we're going to put in a defective date to allow for further discussion of January 30th, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, a recommendation is a Senate Draft 1, noting the excuse of Senator Kanuha. Any of the members present wishing to vote no or WR? Seeing none, recommendation has been adopted.
Okay, for SB 3139, we're going to pass this with amendments. We're going to remove Section 2 on page 3, pursuant to HMSA's concerns. And we're gonna also adopt, technical non-substantive amendments for clarity and consistency. Any comments, questions, concerns? Oh, put a defective date also, January 3rd, 2050, to continue further discussion. Any comments, questions, concerns? Seeing none, Vice Chair for the vote passed with amendments.
Okay, recommendation 3139 is the Senate Draft 1, noting the excuse of Senator Kanuha. Of the members present, any WRs or no? Seeing none, your recommendation is adopted.
So for SB 2272, Chair's recommendation is to pass it as is. Any comments,
Sorry,
questions?
you said 22. Oh, yes.
Yeah, aren't we in 2272?
3207, I thought. Yeah, with 3207.
3207.
Yes.
Sorry. I missed
Happens to the
it.
best of us.
Okay, that's right. Okay, senior moments.
It's okay.
Okay, SB 3207, relating to background checks. As noted in the discussion, AG's proposed concerns, AG's concerns need to be taken seriously by the healthcare administration, by HAH, because even if we pass it, it's gonna be subject to veto. But I want to continue discussion. So we are going to pass this with amendments. We're gonna accept HPHA proposed amendments. We're gonna add in technical non-substantive amendments for clarity and consistency. We're gonna put in a defect date of January 3rd, 2050 to continue discussion. We're gonna request the Attorney General to propose amendments regarding the collection of fingerprints so that we don't kill off the entire bill just because of one particular concern. Okay, any other comments, questions, concerns? Pass with amendments.
Okay, just a real quick comment. There have been bills that have gone to the governor's office before the AG has opposed that he has signed, so I wouldn't just totally take it out. That being said, recommendation 3207 is the Senate Draft 1, noting the excused absence of Senator Kanuha. Are there any other senators wishing to vote no? Reservations? Seeing none, your recommendation has been adopted.
Yeah. Okay, SB 2271, relating to hospital licensing. Chair's recommendation is to pass it as is.
There you go.
Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation on SB 2271 is as is, noting the excused absence of Senator Kanuha. Any of the senators present wishing to vote no? WR? Seeing none, your recommendation is adopted.
Okay, now SB 2272, Chair's recommendation is to pass this as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 2272 as is recommendation, noting the excused absence of Senator Kanuha. Any WRs or no? Seeing none, recommendation has been adopted.
Okay, for SB 967, Chair's recommendation is to defer this pending the resolution of the Sunrise analysis, for which there is already a concurrent resolution that was filed on February 6th. So defer. Any comments, questions, concerns? Seeing none, there's no vote.
There's
so
no
we'll
vote,
move
yeah.
on. SB 2285, Chair's recommendation is to pass this with amendments. We are going to blank out the appropriation. On page 4, line 15, we were going to replace 2027 with 2028. We are going to note on the committee, in the committee report, Department of Health's request for $3 million. Any other comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation 2285 is a Senate Draft 1, noting the excused absence of Senator Kanuha. Any WRs or no? Seeing none, recommendation is adopted.
SB 2289. Okay. I'm going to pass this with amendments. We're going to remove sections 18 and 19 per SHPTA's concerns regarding hospital. Okay, we're also going to remove the hospice as part of this, but I am going to note that the only standalone hospice in East Hawaii got closed, okay? So I don't know about you folks' concerns, but I'll take your concerns to heart, but we do need hospice. And So we're gonna pass this with amendments. Remove sections 18 and 19, and we're going to remove hospice for now. But if we don't have enough, I'm gonna revisit it again, okay? I'm just letting you know. Any other comments, questions, concerns? Seeing none, Vice Chair for the vote, passed with amendments.
Okay, 2289, recommendation is a Senate Draft 1, noting the excused absence of Senator Kanuha. Any WRs or noes? Seeing none, recommendation has been adopted.
Okay, so we are gonna adjourn that hearing, and then we're gonna recall the deferred calendar from February 6, 2026. For SB 2479, Chair's recommendation is to pass it with amendments. We're gonna remove Section 1 of Section 1 and remove Section sub C sub 1 from Section 8 of SB 2479. We need you folks to be quiet, please. Okay, any other comments, questions, or concerns? Pass with amendments.
Okay, 2479, recommendation Senate Draft 1, noting the excused absence of Senator Kanuha. Any WRs or noes? Seeing none, recommendation has been adopted.
For SB 2589, we're gonna pass with amendments. We're gonna insert the language from SB 2269, replace the language of 2589 with that of 2269, which is similarly titled and similar, and a lot of similarities. And we are gonna note in the committee report the request for $3 million. The language that we are inserting into 2589 has blank appropriations and blank FTEs. So we're going to note the request of $3 million to cover all of these costs. Any comments, questions, concerns? Pass with amendments.
Okay, recommendation is a Senate Draft 1, noting excused absence of Senator Kanuha. Any WRs or noes? Seeing none, recommendation has been adopted.
And with that, we are adjourned, and thank you for